Welcome. Today we're delving into a challenging topic, bladder metastasis. We'll explore what it is, how it develops, and what can be done about it. Bladder metastases occur when cancer cells from a primary tumor elsewhere in the body spread to the bladder. The bladder isn't usually the first place other cancers spread to, but it can happen. Common primary sites include cancers of the colon, rectum, prostate in men, breast in women, lung, and melanoma. The cancer cells break away from the original tumor and travel through the bloodstream or lymphatic system to reach the bladder. The pathophysiology involves a complex interplay of events. Cancer cells circulating in the bloodstream or lymphatic system eventually reach the bladder. These cells then need to adhere to the bladder lining, the urothelium. They then invade this layer and begin to grow, forming secondary tumors within the bladder wall. The microenvironment of the bladder can support the growth and survival of these metastatic cells, facilitating tumor development. Bladder metastases are relatively rare compared to primary bladder cancer. The exact incidence is difficult to determine because many cases might be discovered incidentally during examinations for other conditions. Epidemiological studies often focus on specific primary cancers and their propensity to metastasize to different sites, including the bladder. The frequency of bladder metastases will therefore depend largely on the prevalence of the primary cancers mentioned earlier and their stage at diagnosis. Symptoms of bladder metastases can be varied and may overlap with those of primary bladder cancer or other bladder conditions. Common signs include hematuria or blood in the urine, increased urinary frequency, urgency, and pain during urination. Less frequently, patients may experience pelvic pain or symptoms related to bladder obstruction if the tumor is large enough. Sometimes bladder metastases are asymptomatic and are only discovered during imaging scans performed for other reasons. Diagnosing bladder metastases typically involves a combination of imaging and tissue biopsy. A cystoscopy, where a thin tube with a camera is inserted into the bladder, allows direct visualization of any abnormal growths. Imaging techniques such as CT scans, MRI, and PET scans can help determine the extent of the disease and identify the primary tumor site if unknown. Crucially, a biopsy of any suspicious lesion in the bladder is required to confirm the diagnosis of metastatic cancer and to determine the cell type, which will help in identifying the primary source. Unlike primary bladder cancer, bladder metastases aren't typically classified by the same staging system. The classification and management are heavily dependent on the type and stage of the original primary cancer. The primary cancer will determine treatment approaches and overall prognosis. However, when describing bladder metastases, physicians may describe if there is one or more secondary tumors present, their size, and whether the cancer has spread elsewhere from the bladder as well. Treatment for bladder metastases is individualized and depends on several factors, including the type of primary cancer, the extent of the disease, and the patient's overall health. Systemic therapies, such as chemotherapy, immunotherapy, or targeted therapy, are often the primary approach to address the underlying primary cancer. Local treatments for the bladder metastases themselves may include transurethral resection of the bladder tumor, or TURBT, to remove the tumor. In some cases, partial or radical cystectomy, the removal of part or all of the bladder, may be necessary. Radiation therapy can also be used to control tumor growth and alleviate symptoms. Preventing bladder metastases is primarily focused on the early detection and treatment of primary cancers. Regular screening for certain cancers, such as colon, breast, and prostate cancer, can help identify and treat these conditions before they spread. Maintaining a healthy lifestyle, including a balanced diet, regular exercise, and avoiding tobacco use, can also reduce the risk of developing many types of cancer. The prognosis for patients with bladder metastases is generally guarded and depends heavily on the primary cancer type, its stage, and the patient's response to treatment. Some primary cancers are more aggressive and prone to spreading than others. Newer research focuses on developing more effective systemic therapies, including immunotherapy and targeted therapies, to improve outcomes. Clinical trials are constantly exploring innovative approaches to treat metastatic cancers and improve the quality of life for patients.